Hello, I'm Dominic. I'm a tech here at Advanced Training and Rehab, and today I'll tell you exactly how to be a great physical therapy technician. All right, so to start your day, you're going to want to clock in at the front desk, and then you're going to want to go back and check the laundry, see if anything needs to be changed, anything needs to be taken out, and then once you do so, you're going to want to go ahead and fold the laundry. So to fold towels here, you're going to want to fold it hamburger style one time, just like so, and then neatly put it into a pile. And then for the pillowcases, you're going to want to fold it hamburger style 2 times. So once, and then one more time. Again, neatly put it in a stack. Once you're done with that, you're going to want to throw it next to the hydroculator, which is right next to where the hot packs go. This is where all the towels will go for the day. And then as far as the pillowcases go, you're going to want to throw them and disperse them under each table around the PT clinic. All right, so one of the main things that you're going to be doing around here is getting hot packs and cold packs ready for the patients and therapists. To start with a hot pack, you're going to want to get a small and go ahead, go into the hydroculator, grab a small hot pack out of there. Each hot pack needs its own holder, and there's many different ways you could do it. This is the way that I was taught. Go ahead, fold it in the holder, put it somewhat in the middle of the towel, flip the bottom up about halfway, and the top right over it, and then it's completely folded. Now, there's other ways you can do it. Some people like to roll it, but the main goal is to just have that hot pack completely covered up so it's not too hot for the patient. And then, whenever you're putting them back, just make sure you put it on a hook, because then you'll have to go fishing, and you have to use this to go ahead and grab it out of the hydroculator. So, putting back a hot pack, just like so, throwing it back on top of the hook, and you're good to go. Now for a big one, or also known as a lumbar, a back, you're going to want to have 2 big hot pack holders. The first one is just laying flat down, and the second one you're going to want to open up and throw that big hot pack right in there. Also make sure they do not have too much water on them, or else you'll make a mess. So go ahead, fold it in, and then depending on the patient, you're going to want to grab primarily 2 towels. If it's just going on their knees, maybe just 1, but you're going to want to grab 2 towels and hand it to your physical therapist. Once you're all done, again, take it out, put it back in the hydroculator. With the big ones, they don't necessarily need to be on the hooks, but again, every clinic does it differently. Go ahead, close the hydroculator, and put the holders back. All right, so another big thing that you're going to want to be doing during your shift here at ATR is cleaning off the tables. Now, what indicates a dirty table is sort of the pillow, not really vertical. Here at Crestwood, whenever they are vertical, that means it is a clean, good table ready to go. When it's sort of a mess, pillow maybe in use, or someone might have just gotten off the table, that's when it's good to clean it. So you're going to want to replace every pillowcase, especially if the patient laid their head on it, and you're going to want to spray down the table as well. Now you also got to make sure if there's a patient in front of the table, you do not want to spray them. You want to spray real gently, kind of silently, if you know what I'm saying. So go ahead, wipe down the table, and then you're going to want to put the pillowcase back on, located underneath the table from this morning. And then once you get that pillow in the pillowcase, go ahead and place it vertically so it looks like it's ready to go. So at Advanced Training and Rehab, normally patients, whenever they start their day, they're going to start out on a hot pack, and then whenever they leave, they're going to leave with an ice pack on them. What you're going to want to do is either help out the patient or the therapist. Whenever they're done with that hot or cold pack, go ahead and grab it from them, just to make the clinic flow the best as possible. Often you will want to go ahead and follow the therapist to that table and grab it from them. Also, whenever you're grabbing a hot pack, it helps to ask if they need a towel or not, just based on whether they need to use it for their ultrasound for their next couple steps. So that's pretty much what you're going to do at ATR. All right, so there's a lot of common misconceptions that techs really have on what they can and cannot do within the clinic. Some of the main things that a tech cannot do is do any physical contact with the patient, along with doing any ultrasound or putting stim pads on. This includes like balancing exercises or transfers. You do not want to go ahead and touch the patient. If they do ask for your help, go ahead and ask a physical therapist if they're free. Some of the things they can do is you can grab equipment around the clinic to go ahead and get them started with their exercises for the day. You can also direct them around the clinic to where they may need to be next. So while you're here as a tech, you're going to want to build relationships, most importantly. That is either with the therapist or with the patients. You are going to want to build that rapport with those patients so they can keep wanting to come back here. Maybe, talk about their personal life or their injury. It is always a great thing to be real comfortable with the patients so they are always wanting to come back. That goes the same with the therapist. You're going to want to build that chemistry so you can continue that great workflow while you're here at ATR. Also, while you're here, possibly as a student, either going into PT school or you are in PT school already, please do not hesitate to ask any questions for the therapist. Obviously, you're going to want to do it at an appropriate time, but there's no maximum level of growing. You are always going to want to be a sponge while you're here in the clinic, and please use that to your advantage so you can continue on into your career.